Um, and that contains an artery we've already seen before. Hopefully everyone's seen the thoracoacromial artery on like the second day of class or something. And then we also have now a couple new ones. We have a lateral thoracic artery, which, well, maybe you've already seen this going to serratus, but definitely some new ones here, these circumflex humeral arteries, of which there will be an anterior and posterior. And you can see they wrap around what's called the surgical neck of the humerus. And when you look at these in lab, know that the posterior one is much larger. So if you see these two arteries coming off and you see one that's much larger than the other, that's going to be the posterior humeral circumflex artery. Okay? So those are the last arteries given off by the axillary arteries. So all these arteries, the circumflex humeral, the lateral thoracic, and the thoracoacromial, are all considered branches of the axillary artery. After that, any further branches are branches of the brachial artery. And the big obvious one, not always obvious, but hopefully obvious, will be this artery called profunda brachii, or simply you can call it the deep artery of the arm. Okay? And that'll be the blood supply to the posterior compartment of the arm. So that'll come off high after the brachial artery begins and go posteriorly. You'll see it between the heads of triceps. Here, you can see on these anterior depictions, you can see the junction between axillary and brachial artery a little bit clearer. You see it's marked at the edge of this muscle teres major. So this muscle is obviously latissimus dorsi, but just underneath that you see this one going here. That's the lateral edge of the teres major muscle. And you should be able to identify these muscles in the axilla, because I'm going to dissect them all. But you should know what their relationships are. At the lateral edge of that teres major is where you have the brachial artery begin. All right, blood supply at the elbow. So the brachial artery is coming down, gives off the deep artery of the arm. It gives off these radial and ulnar branches. And then it'll give off a bunch of arteries here, but they weren't labeled in these slides that I stole, so I'm not going to have you know too many of them. Except for, I think, like this one is pretty obvious in most bodies. The radial recurrent artery, which will come off the radial artery and loop upwards over the lateral epicondyle, so look for that one. Not labeled here, but called the radial recurrent artery. Okay. These arteries continue distally, again, until they get to the hand. And like I said, that ulnar artery will contribute to a superficial palmar arch, which will be easy to see. From that superficial palmar arch, you'll have these little straight arteries that go towards the fingers, and they're labeled here as digital arteries. There's common and proper ones. So these big ones here, more closer to the arch, are called common palmar digital arteries. Common palmar digital arteries. And then they get to the fingers and they split. You see they split here on each side of adjacent fingers. And at that point, they're called proper palmar digital arteries. Okay, so those are from the superficial and deep palmar arches. And here you see a nice cartoon of the superficial palmar arch. You'll see a big arcuate artery like that with branches coming off towards the fingers. That's what you should look for. Okay. A quick note about veins. So venous drainage of the upper limb follows from the hand, from the dorsum and palmar surfaces of the hand, superiorly, ultimately going back into the axillary vein. So there's a couple veins, some of these you know, so we definitely have talked about the cephalic vein before. The cephalic vein, you should always remember, is on the radial or lateral aspect of the upper limb. There's going to be a new one we learned, the basilic vein, which is on the medial or ulnar aspect of the forelimb. And then, not always, but variably, there'll be this median antebrachial vein in between those. And those all communicate with an important vein, very superficial, in the cubital fossa in the elbow called the median cubital vein. So on the limb that I dissect superficially, this is like essentially what you'll see. You'll see something like this, where just the skin is taken off, and you should be able to follow all these veins in the superficialmost aspect of the upper limb. So there's a communication here between the cephalic and basilic veins at the median cubital vein, and then these continue upward. The cephalic vein will go through this space here. Does anybody remember the name of that space between these two muscles? Delto something. Yeah.
Delto pectoral.
Groove. Yeah, exactly. So that's where we saw this part of the cephalic vein already, and now we're going to get sort of more of its full course tomorrow. The basilic vein also joins up with the axillary vein, but it does so by a deeper route, and we won't follow it the whole way. Here's where the cephalic vein begins. The cephalic and basilic veins begin at the dorsal, this complex network of veins called the dorsal venous arch. And so in some individuals, these veins are really obvious, either at the dorsum of the hand or at the cubital fossa. This is also commonly the site of venipuncture, or where you'll take blood from patients. You'll take it from the median cubital vein if it is obvious. In like a very small minority of individuals, and something like 5% of people, there's an unusual bifurcation pattern to the radial arteries, such that it's actually superficial to the median cubital vein in these individuals, and that's a danger of being cut at venipuncture here. But most people, the artery is protected by this thick bicipital aponeurosis and fascia of the upper limb. Okay, I think that is all. Yeah, so these slides, I'm not going to go through all these slides, but these are but these are for your review. If you are having trouble memorizing these muscle motions, I list them all out here for you on these two slides. Okay, that's it. That's it.
Okay, remember tomorrow, 2:32. Yeah, the second floor. A lot of information.
In the medical school, this is 4 days.
Are you serious?
Really?
They do a little bit at a time.
That's such a... We get everything.